Hello, my name is Mitul Mehta. I'm the Fellowship Director of the Vitreoretinal Surgery Fellowship at the Gavin Herbert Eye Institute at the University of California, Irvine. We take one American fellow per year for a total of 2 fellows for a 2-year fellowship. We have 5 retinal faculty covering adult as well as pediatric retina, ROP, and inherited retinal disease. In addition, we have 1 UVI's faculty member who's actively involved in the fellowship as well. As you can see, we have quite a bit of diversity in the trainings of our faculty. So as a result, the fellows get a wide variety of training diversity. On the diagnostic systems, we have OCT systems by Heidelberg, Zeiss, as well as OptoView, and OCT angiography, in addition to Optos wide field viewing systems for fluorescein angiogram as well as ICG angiogram. We have electrophysiology by way of ERGs, multifocal ERG, and microperimetry. In addition, we have B-scan as well as UBMs, which are done by the retina faculty as well as the fellows. And all of this is integrated into the electronic medical record, which is EPIC, with Zeiss Forum to manage our images. Will you be an injection monkey? No. Unlike many retina fellowships, here the attendings do most of the injections, and they still do some of the lasers as well. In the academic clinic, most of the injections tend to be done by the residents. Obviously, as a fellow, we expect you to be able to do the more complicated patients, and you'll be able to learn how to do that as well. The fellows clinical schedule is as listed here. The first and second year tend to be in different places, with the exception of the operating room and when they're at the VA. Our surgical schedule is as listed here. As you can see, someone's in the operating room almost every single day. And this gives you a wide variety of surgical diversity as well as number of cases. Some of it has more autonomy than others, and we find that this leads to a very good training for our fellows. In addition, we have all 3 surgical machines for vitrectomy surgery: the Alcon Constellation, the Bausch & Lomb Stellaris, as well as the Dork Eva. You'll get proficient at all 3. We have all gauges of surgery and all 3 types of viewing systems: the Zeiss Resight, the Oculus Biome, as well as the contact lens systems by Avi. On average, the senior fellows graduate with approximately 325 to 350 primary cases, with 700 to 1,000 cases total, including assistant cases. There's a broad range of pathology, especially a lot of diabetics from the county/Medi-Cal population, with complex TRDs as well as medical retina. Retinal detachments from the private/Medicare clinic as well as the county Medi-Cal clinic, and membrane peels from the private clinics and the VA patients. We also do a variety of secondary IOL placement techniques, and all the fellows become extremely proficient at every single technique. In addition, primary buckles are taught here as well, and we do a lot of primary buckles as well as VIP buckle combination surgeries. The fellows also become proficient at pneumatic retinopexy. This is an important skill that everyone needs to learn, and so we make sure the fellows get hands-on experience very early on in the fellowship. In addition, we have exposure to pediatric retina cases with endoscopic vitrectomy with Dr. Riazi. If you've never seen EPIC, this is what the electronic medical record looks like. It looks just like the old paper charts, but now it's in electronic form, so we can access it from home as well as from your cell phone, and obviously in the clinics. We have a drawing system in the EMR as well, so you can document your findings very easily. In terms of benefits, the salary and health benefits are provided by appointment as a part-time staff physician at the Long Beach VA. Typically, fellows make $65,000 plus per year, including extra hours of the VA, depending on how much the fellow decides to staff resident cases and do extra hours work. In addition, they get $10 per consult that they staff with the residents accrued to educational expenses in their account. Additionally, they get 2 weeks of vacation per year. In terms of conferences, we support the fellows to go to conferences and present their research. There are sponsored vitrectomy courses from industry, as well as the first year, the fellow typically goes to ARVO and the Duke Advanced Vitreoretinal Surgery course, and the local course here called the American Retina Forum. In the second year, the fellow goes to a lot more conferences. There's a few fellow-related courses that second years tend to go to, which help for career development and things like that, like AVTT and Fellows Forum. In addition, they tend to go to ASRS and the American Academy of Ophthalmology meeting with a stipend from the university, as well as, again, the local American Retina Forum meeting. Out of pocket, the fellows often choose to go to the Buckle Society or the Mass Eye Year course in the first year, but that's up to the fellow. In terms of call schedule, the fellows take call week on, week off with the other fellow. The first year does not begin their call until August, and they cover private patient calls, in addition to the residents calling you, asking for questions, because the residents are primary call in the emergency room and with the county patients as well. On average, there are 1 to 2 detachments that present after hours per week. In terms of the trauma call schedule, the trauma call is split among all 6 fellows across the entire department for the year. During the trauma call, you accept and refuse transfers from local hospitals, and you do rupture globes. On average, there's a rupture globe every 2 weeks. We also have international co-fellows in medical retina. They're retina fellowship trained from various countries, and they assist seeing patients mainly in the attendings clinics, and they perform laboratory bench research at UCI. They advise but do not really take on surgical cases because their license doesn't allow them to do that. As a result, they bring a unique perspective to the practice of retina from across the world, but they don't take away the surgical cases from the American Retina Fellows. In terms of research and clinical trials, we have a vast variety of clinical trials as well as bench research, and the fellows can take part in all of these. Typically, they are the injecting physicians for the clinical trials at UCI, so this way the faculty can be blinded investigators, and the actual treating physicians will be you, the retina fellows. We also have a vitreoretinal wet lab, which is complete with surgical microscope and machines graciously loaned from Bausch & Lomb and Dork. We also have a True Vision heads-up 3D system if you would like to use that as well. We work in 3 different locations: the Long Beach VA, as marked here, as in the top left corner of your screen, the UCI Medical Center, which is in orange, 2 exits away from Disneyland, which is labeled as Anaheim Resort on this map, and the Gavin Herbert Eye Institute in Irvine, which is on UCI's main campus. To give you a general idea where that is relative to the bigger cities in Southern California, Los Angeles is about 40 miles away, San Diego is about 70 miles away. It takes about an hour to get to LA, depending on traffic, and about an hour and a half to get to San Diego. Depending on where you live, the commute's around 15 minutes plus or minus. Most of the fellows tend to live in either Irvine, Newport Beach, or Costa Mesa, because it's equidistant from Long Beach, Orange, as well as Irvine, and they're all nice places to live. Irvine is a very bike-friendly city, and some of the attendings even ride their bikes to work. Southern California is a gorgeous place to live. You know, there's wonderful hiking and beaches. This bottom left here is a picture of Crystal Cove Beach, which is about 5 minutes from the Eye Institute in Irvine. Some of the fellows do go surfing in the morning before clinic. Just don't hurt your hands, please. If you like biking, there's biking trails all over Southern California, very close to where we are. Our former fellows have been placed all around the country, but a lot of them like to stay in Southern California. Some of them do go up to Northern California as well. They've gone from a variety of private practices to academic practices. And here is some contact information from some of our former fellows, our current fellows, and all the faculty. So if you have any questions, feel free to contact any of us. Come on down, learn how to do some retina, and we'll have a good time as well. Thank you.